Hi, my name is Bobby Young, and I'm going to talk to you today a little bit about caregiver burnout and a new program to the Midwest called PACE. Many of us have a family member or know somebody that lives in the nursing home. We know for many this is the last resort. They're no longer able to live independently, their families aren't available, or their families have been involved in their care and they have reached a point where they can no longer take care of them due to their own health, financial issues, or they're just burned out. Most long-term caregivers have fatigue and develop frustration when they're providing care to an elderly person. Somebody that is ill has to take them to doctor's appointments, provide their medication set up, and just overall personal care. I read an article by Carol Bradley on agingcare.com that states caregiver burnout can manifest through several actions such as yelling, hitting, or neglecting a loved one. Burnout doesn't happen overnight. It is a result of days, weeks, months, and years of managing caregiver responsibilities. There are programs out there that can assist with caregiver burnout and allow loved ones to stay in their homes with assistance. So I work for Emmanuel, and we have a program called PACE. It's a fairly new program to the Midwest, and it stands for Program of All-Inclusive Care for the Elderly. What is PACE? It's a highly successful model of fully integrated acute and long-term care for frail, older adults. It's the only federally qualified provider-sponsor health plan which integrates Medicare and Medicaid services into one seamless service package for participants. It's in 33 states with 167 centers currently in operation. Who do we serve? Our participants must be 55 and older, meet nursing home level of care, live within our service area, and be able to live safely with our services. Most participants are eligible for Medicare or Medicaid. Participants will receive all of their health and social services through the PACE organization, 24 hours a day, 7 days a week, 365 days a year. An interdisciplinary team, including physicians, provide and coordinate all services for the participant. In the PACE model, we have many different entities that are included. So we have transportation, we have dietary, we have home health services, social services, physical therapy, occupational therapy, nutritional counseling, as well as a full clinic. We work as a team, and all decisions in the PACE model are made through the interdisciplinary team, which include a member from each of the departments. You have social services, pharmacy, we have an activities department, primary care, transportation, center director, the therapy department, personal care aides, nursing, and nutrition. PACE has an approach to healthcare, not like any other healthcare entity. We are proactive and preventative in treatment measures. Healthcare costs are more predictable, and we have careful coordination of healthcare by all providers. How much does PACE cost? If you have Medicaid, there's no monthly premium to be a PACE member. If you have Medicare and Medicaid, there is also not a fee. If you have Medicare only, that amount may vary based on your financial situation. There are no benefit limitations, copays, or deductible for services within a PACE network. PACE participants may be fully and personally liable for costs of any unauthorized or out-of-PACE program agreement services. On average, according to the National PACE Association, a PACE participant has better overall satisfaction rates with perceived overall better quality of life. They have better coordinated access to much-needed health care and services. They spend 75% less time in hospitals when they're admitted, and 21% less time in a nursing home when admitted for skilled care. And they live, on average, 1.3 years longer than someone that doesn't have PACE services. I have some pictures here to just share. We have a location in Council Bluffs, see that at the top left of the screen, as well as in Omaha. They just joined in May of last year. You'll see that one at the bottom of the screen, and then just one of our many vans that you may see around town. This is important for you to know because when there's a family member or a loved one who has reached that point of burnout, PACE is definitely an opportunity for them to get some support and allow your loved one to not live in the nursing home, be at home with our services, and we provide help for you as well with our social service department, pastoral care. I did want to share on April 19th of 2016, President Obama signed the Older American Act, Reauthorization Act of 2016. Kathy Greenlee, Assistant Secretary for Aging, states the OIA provides a promise to preserve the right to live independently with dignity, making everyday decisions according to our individual preferences and goals across our lifespan. In a few short years, more than 77 million people will be over the age of 60, and more than 34 million people, most family and friends, will be supporting a loved one over the age of 60, and these numbers will continue to grow for the next several decades. It is a program like PACE that will allow loved ones to live their life to the fullest in their own home with the necessary support and assist families to stay together without feeling all of the burden. Thank you for listening to me today.